Welcome to my channel Medicine Guide. Before you take that next dose of betamethasone, there's something you need to know. This common steroid can interact with certain medicines, vaccines, and even some health conditions in ways that could put your health at serious risk, from increasing the chance of infections, seizures, or tendon rupture to altering the effects of blood thinners or causing dangerous electrolyte imbalances. These interactions aren't just medical fine print, they can be life-changing. In today's video, we'll break down the major drug and disease interactions of betamethasone, so you'll know exactly what to watch out for, and when to talk to your doctor. Let's get started, but before that, please subscribe to my channel Medicine Guide. Major drug interactions of betamethasone, BCG Vaccine and Betamethasone. If you are currently being treated or have recently been treated with betamethasone, you should let your doctor know before receiving BCG vaccine. Depending on the dose and length of time you have been on betamethasone, you may be at risk for developing an infection from the vaccine or have a reduced response to the vaccine. In some situations, your doctor may want to delay vaccination to give your body time to recover from the effects of betamethasone therapy. Conversely, if you have recently been vaccinated with BCG vaccine, your doctor may choose to postpone treatment with betamethasone for a few weeks. Bupropion and Betamethasone. Bupropion may rarely cause seizures, and combining it with other medications that can also cause seizures such as betamethasone may increase that risk. You may be more susceptible if you are elderly, undergoing drug withdrawal, have a history of seizures, or have a condition affecting the central nervous system such as a brain tumor or head trauma. Talk to your doctor if you have any questions or concerns. Your doctor may be able to prescribe alternatives that do not interact, or you may need a dose adjustment or more frequent monitoring by your doctor to safely use both medications. Also avoid activities requiring mental alertness such as driving or operating hazardous machinery until you know how the medications affect you. Ciprofloxacin and betamethasone. Ciprofloxacin and other medications in its class can cause tendinitis and tendon rupture, and the risk may be increased when combined with a steroid such as betamethasone. Older adults over 60 years of age and those who have received a kidney, heart, and/or lung transplant may be particularly susceptible. Tendon rupture can occur during or up to several months after finishing ciprofloxacin treatment and may require surgery or result in prolonged disability. Talk to your doctor if you have any questions or concerns. Your doctor may be able to prescribe alternatives that do not interact, or you may need a dose adjustment or more frequent monitoring to safely use both medications. Stop taking ciprofloxacin and call your doctor immediately if you experience pain, swelling, or inflammation of a tendon area such as the back of the ankle, shoulder, biceps, hand, or thumb. You should also avoid exercise or use of the affected area until further instruction from your doctor. Desmopressin and betamethasone. Using desmopressin together with betamethasone may increase the risk of hyponatremia, a condition associated with low levels of salt in the blood. In severe cases, hyponatremia can lead to seizures, coma, and even death. Talk to your doctor if you have any questions or concerns. Your doctor may be able to prescribe alternatives that do not interact, or you may need a dose adjustment or more frequent monitoring to safely use both medications. You should seek medical attention if you experience loss of appetite, nausea, vomiting, headache, lethargy, irritability, difficulty concentrating, memory impairment, confusion, muscle spasm, weakness, unsteadiness, decreased urination, and/or sudden weight gain, as these may be symptoms of water intoxication and hyponatremia. Early diagnosis and treatment are essential to help prevent progression to more serious and life-threatening complications. Warfarin and betamethasone. Betamethasone may alter the effects of warfarin. Both increased and decreased effects have been reported. Talk to your doctor if you have any questions or concerns. Your doctor may be able to prescribe alternatives that do not interact, or you may need a dose adjustment or more frequent monitoring to safely use both medications. Contact your doctor if you experience any unusual bleeding or bruising, or have other signs and symptoms of bleeding such as dizziness, lightheadedness, red or black, tarry stools, coughing up or vomiting fresh or dried blood that looks like coffee grounds, severe headache, and weakness. Also be alert to potential signs and symptoms of blood clots such as chest pain, shortness of breath, sudden loss of vision, or pain, redness or swelling in an extremity, and seek immediate medical attention if they occur. Now have a look on major disease interaction of betamethasone. Betamethasone in bacterial, fungal, protozoal, viral infections. The immunosuppressant and anti-inflammatory effects of corticosteroids, particularly at higher dosages, may reduce resistance to infectious agents, increase the risk of disseminated infections, mask symptoms of infection, and reactivate or exacerbate latent/resolved infections. Fatal cases have been reported. Avoid use of corticosteroids in patients with cerebral malaria. Screen patients for active, or history of, infection with tuberculosis, hepatitis, varicella, measles, and amoebiasis. Especially prior to prolonged treatment, closely monitor for reactivation of latent infections. Chemoprophylaxis may be required. In general, corticosteroids should not be used in patients with active infections, especially systemic fungal infections, unless medically necessary to control drug reactions. However, for corticosteroid-dependent patients who develop a severe or life-threatening infection, continuation of corticosteroid therapy with at least physiologic replacement dosages should be considered, since these patients may have secondary adrenocortical insufficiency. Removal of external steroid during periods of stress may be detrimental to these patients. Conclusion: betamethasone can be a powerful medication, but when combined with certain drugs, vaccines, or medical conditions, the risks can be serious. Always inform your doctor about everything you're taking and any health issues you have. Staying informed is the best way to stay safe. That's enough for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer: channel's intention to make this video is for informational purposes only. Consult your doctor or healthcare provider for use of any medicine or for query of any disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guide.